This episode is a reminder that when we take risks, say yes to adventure, and follow the path that feels right, big things can happen.
I actually was quite emotional when I was there. I went on a helicopter ride around, and it was a sunset helicopter ride. It was really, really special. And while I was up there, I remember thinking, I am so blessed. I am living a life that is so full, and having those little moments where you just go, I'm so thankful to all the people that encouraged me along the way and kind of got me out here.
If you want to hear more great stories from our healthcare community, be sure to click follow and subscribe. And don't forget to check us out on our Instagram page, It Takes Heart, for all the behind the scenes fun.
We care for the land and sea.
Today we are joined by Karli Grace, an oral health therapist who swapped private practice for locum life. From Alice Springs to the Torres Strait, Karli has worked hard to improve oral health outcomes in some of Australia's most remote communities. Welcome, Karli, to It Takes Heart.
Thank you. It's a pleasure to be here. I feel really honoured.
It's exciting to have you. Can we just talk about oral health therapist? That is a mouthful.
It's a lot. This is why we shorten it to OHT. But if someone says, oh, what do you do for work? No one knows what an OHT is. And no one knows what an oral health therapist is either.
I need you to help. What is an OHT? We know what an OT is. An overhead projector.
An oral health therapist, a lot of people are familiar with dental hygienists. So you go to your regular dental clinic and you get your teeth cleaned. And then back in the day, dental therapy was a huge thing, especially in the school dental service. So an oral health therapist is almost an amalgamation of those two roles in the dental world, but then it also has a little bit more around it. So it's a lot of, it's a heavy focus on prevention. So if you have a patient come to you that is going through cancer treatment, you diagnose the different conditions that they might suffer from because of their cancer treatment, and then help them, keep their mouth as healthy as possible. So you're giving them the tools. But then, there's so many other areas in the oral health therapy world, but a lot of it is pediatric dentistry and prevention. And then it has a strong focus on periodontics as well, which is gum health or gum disease. So we diagnose, treat, manage and maintain gum disease. And we're a real supporter in the dental little family or the dental team to make sure that patients that are going through, say, full mouth rehabs are getting the best treatment that they can get, if that makes sense.
Yeah. I was just going to say, with the paediatrics, sorry, can I just ask you about the paediatric care? So you could do the paediatric dentistry, is that what you mean? So I take the 3 kids in and line them up and we have a little look around.
Yeah.
And so when we do take them to the dentist, are we seeing the dentist or are we just...
It depends on
do people
dental clinic.
Yeah, does everybody have one?
It's becoming very popular. So some clinics will have multiple. The last private practice that I worked in, we had 4 across 3 clinics. So usually on a day-by-day basis there would be 1 working, and they do see usually all the children. So you're doing restorative treatment, you're doing extractions, you're doing essentially, people are familiar with root canal therapy. We don't do root canal therapy on children's teeth, but it's a nerve treatment to be able to prolong the life of the tooth in the mouth rather than extracting it. So it is all this sort of the therapy base or the restorative dental treatment that would happen to a child is usually going to happen from an oral health therapist. But then you also do your general checks and cleans, so we'd see adults of all ages. I extended my scope, so I have full scope, and I can do fillings on all ages, and I've done a composite veneers course, so I can do people's veneers.
Add on.
Yeah, so you can really add on, but you're not even confined to just working in a dental clinic doing clinical treatment. You can go and do education, and you can go and do, you can work in academics and research.
How far off being a dentist are you then? Like when you're going, I can add on this, I can add on that. Do you want to be?
Like where's the gap?
So I get asked that question all the time. I am so happy being an oral health therapist because I love the role that I have in working with children and working in preventative healthcare. Whereas I see the dentists, sometimes you look at dentistry as they're kind of like the mechanics that fix the problem once it's already occurred. Whereas from an oral health therapy perspective, you're giving people the tools to be able to
prevent getting to that point.
Yeah, prevent bad oral health outcomes. So you're kind of enforcing good oral hygiene habits at any stage of life, not necessarily just children. So I love that because I love working with people and I love communicating and I love sharing my knowledge. Whereas if I was a dentist, you still do have that capacity by all means, but I think you would end up focusing more on just the, bread and butter fillings and crowns and root canals and extractions. Whereas I get that opportunity to really meet with my patients and then end up, you get to know them and it's a little bit more personal, but
if you wanted to be a dentist, say,
you have to go
back and do the whole 4 years.
Yeah.
Right.
And can I ask if you were, did you start a dental hygienist?
No, so I started straight out of high school. Straight out of my first job at Sumo Salad.
This is not my career here now.
Not where I'm going.
I've got better things.
I actually trialled a few different things. I wanted to go down the legal pathway, so I worked for a criminal lawyer first.
Oh, wow.
And then I did like a pre-enlistment prep course for the Defence Force. I thought I wanted to be in defence. And I very much fell into the dental world. I worked as a junior dental assistant. This is going back many years. And you do, I did a Certificate 3 in dental assisting, and then I sort of went on and explored more opportunities in that role, and then added on a Certificate 4 in oral health education. So that was where I really started to get that feeling of I can really help people by giving them all this information about their oral health or about their health in general and what that can mean for their oral health, because it's so intertwined. Especially chronic diseases and systemic health issues are really related to dental health as well. And so I really started enjoying that, and then I was encouraged by a lot of people to go and study and people suggested studying oral health therapy more so than dentistry, because as a therapist, I think it was maybe obvious my personality would be better suited to working with people that little bit more and having that more preventative approach rather than that mechanic approach, if that makes sense.
Clue's actually in the title, isn't it?
Well, yeah, exactly.
Yeah.
Therapist,
yeah.
So you mentioned they're working in private practice.
Yes.
But you've been working remotely, sort of locuming around the country. What took you down that path?
So I mean that it's a long journey that got me there eventually. There's a lot of little pathways that eventually led to the work I'm doing right now. But I actually started working as a locum, so fly-in, fly-out worker, more on a contract basis rather than taking permanent positions in remote communities. I started that when I was 21. As a dental assistant, and then that's when I fell into oral health education, and I ended up going over to Indonesia and setting up an oral health program on a remote community.
Wow.
And that was really fun. And it was, the power of Google Translate, I wouldn't have been able to do it because I was probably
you were the team?
It was just me. Well, there was a team in the volunteer organisation I was working for, but we were doing turtle conservation, so it was completely different. We were using toothbrushes to clean the turtles, but I just I saw an opportunity and I thought, these kids are out of school because it was school holidays. Let's set up this little oral health promotion program. And so we kind of got the kids all brushing and made posters and tried to make it fun. So that then again, I guess, highlighted that interest for me that I want to do more. I want to, you can only do that for so long. I want to take that step further. So I ended up going to university, and while I was studying in the uni holidays, I would always go back and work remote because I was a poor uni student. I needed the money, and this was, it's hard to take a permanent position if you're at uni, so this was perfect for me. It's very flexible.
That's a really great idea, actually, when you're at uni, to go and be doing those 100%. Locum roles.
Yeah. I tell a lot of my dental nursing friends that if you want to do it, you can make it happen. So so that ended up taking me to university, and then I always knew that the main goal was to get back out to remote Aboriginal communities and work, because I always had this drive to work for I guess underprivileged people and communities that have disadvantages and disparities. And so it was really important for me to sort of come full circle with that and go back out as a therapist. The dental assistants, they have a huge role when we go out remote as well, but I think being that one that's doing the treatment and making the clinical decisions, and giving feedback to the clients as well, to the organisations that I work for, on how you can approach a certain issue or obstacle, and how you can work with the communities to be able to get the best oral health outcomes. So it feels nice to be out there doing what I always dreamed of.
Where are some of the places you've been?
Oh my goodness. Okay. A community that I go to fairly regularly is Wadair, so up in remote top end Northern Territory. It's a community that unfortunately it has a sort of a bad reputation. It's had a lot of, I guess, social issues and political issues there. But it's actually one of my favourite communities to go to. And whenever I go there, I feel somewhat welcome in the community, particularly the health clinic. I know the staff there now, and I think there's this appreciation that that one person is returning. So that's a community that I really love. And then I've been to, oh my goodness, Maningrida, Milingimbi, Ramingining, Gapuyak, the Torres Strait. I just came back. How many days ago now?
Yeah.
A few days?
Like a few days.
4 days ago or something.
Can you paint a picture? You mentioned there that sometimes some communities might have a bad rep or what have you, but you really enjoy the work there. Can you paint a picture for maybe someone who's thinking, what is remote work? What is a remote community? What are you talking about?
I mean, so remote communities are, well, they're just that. They're remote. They're far, far away. You have to... Do
you fly to them? Do you drive to them?
Well, it depends. So if you're in Central Australia, doing in Northern Territory, we drive to all the communities. So I did a trip at the start of this year in February, I believe it was, and I think we calculated it was about 3,800 kilometres in 4.5 weeks maybe, and that's sort of going from Alice Springs to Ali Karang and then back and then to Tennant Creek and then back and then to Elliot and then we drove all the way over to the WA border and worked in a beautiful community called Docker River, which is just surrounded by the most incredible mountain ranges. But it's so different, if you're from the east coast of Australia. I mean, I haven't done west coast, but east coast of Australia, we see, beautiful green, lush mountain ranges and the ocean and everything. But it genuinely feels like you're in a different country. It is so. The terrain is different. It's red. Like, be expected to see a lot of red dirt, and it will stain your shoes. Actually, I drove up to Nhulunbuy to take a job up in East Arnhem Land, and I worked there for 6 months. This was as an oral health therapist, but in a more coordinator role. And I took my car up there, and I was just in the mechanic yesterday, and they had to replace my fan. I left there in 2019, and it's now 2025. And he said, I had to just take the fan out because it was busted up a bit. And he goes, it was full of dust. And I said, what colour was the dust? And he's like, it was real red. And I said, oh, yeah, that's from that's from working in East Arnhem Land. So, visually it's very different. I guess socially it's really unique because I don't think people get the opportunity to really tap into what it's like living and working in remote communities unless you put yourself in it. So from a cultural perspective, I feel really blessed that I've been able to experience certain things firsthand and sit down and get to know people and get to know their families. It's not just, you go into a dental clinic and you do a couple of fillings or you take a few sick teeth out. You really get this opportunity to connect with people and learn little bits about culture that you don't really see in textbooks or you weren't taught at school. So I feel really thankful for that I have been able to connect with people in that sense.
How was that first time you went to a remote community? Was it daunting? And for someone who's about to do that, what advice do we give them?
So my first community, when I was a dental assistant, I went to Wadair. So it's which I kind of love because it's a place that it was almost where I started doing remote work, and I now still continue going to that community. And the people I work for, the clients, they do know that I love going to water.
And this is up.
This is
top
up,
end.
top end.
Yeah.
So you're taking out a little 4-seater plane, maybe might have 6 seats. Depends on which aviation company you go through. But they're little planes, and they are. I think they're fun.
I guess you're limited on what you can take on those planes.
You just got to. That's the way you got to get out there. Yeah. So it's. That's a challenge in itself for some people.
I was going to say, people need to be aware of that, right? Because some people won't feel comfortable doing 100%.
that. Yeah. I think
it's the same as if you're not into long drives.
Well,
that's a lot of driving that you said.
But if you're not comfortable or confident,
I would have to say I'm a good flyer. I have to be. I've been flying for work for the last 20 years. But I love the drives, and the reason I love the drive is because I get to just rock out and listen to music the whole time. And
are you driving on your own? These really vast distances?
So in Central Australia, when we drive out, you take a nurse with you. Sometimes you'll convoy, depending on if you're taking out a dental van, because we'll set up the large dental vans at a health clinic or at a school, and then the driver of the van needs to get back to the central hub, which will be Alice Springs.
So sort of like mobile dentistry coming around.
Yeah. So we end up sort of taking 2 cars out, and he takes one back, and then he meets us back there to take the van back. So it's a lot of logistical operations that get done behind the scenes that we don't have to worry about. They just sort of go, there's the keys, and here's your, we have to do car checks. My first trip to Central Australia, on my orientation, it was like, all right, get out the back. We're going to show you how to change a tyre.
That was my next question. How handy are you with a car?
I like to say I'm great, but my mechanic will say otherwise.
Because just to give people a scope of the distances you're talking about, how long is that drive?
Yeah.
If you...
I think
you're going to Tennant Creek, you're going to these communities.
So the longest drive I've done was over to the WA border, which from Alice Springs was... I remember putting it in Google Maps, and it was it said 10 hours, and I was thinking, "Whoa, this is a day." And we stopped at Yulara on the way, so where Uluru is. Yeah. So that was cool.
I was just going to say though, no problem, stunning.
But then you keep going, and I think all up it ended up being maybe like a 9-hour day driving, and then you get in, you feel pretty exhausted after that. But I just live on such a high of the work that I do, and you're travelling. Yeah. You're seeing the countryside. It's beautiful.
Because you're right, Yulara, so many people wouldn't get to see it.
No. I've been waiting for a trip to get out there. Yeah. And so that particular trip, I have to say, out of all of the trips I've done, there is one other trip that is sentimental, that is special. But that trip was very much, it was really profound for me, because I ended up getting to go to Uluru, and just witnessing such a magnificent landmark and even Katajuda, which isn't even it's close by, but I guess it's nowhere near as popular. There's something spiritual about it, and it was I actually was quite emotional when I was there. I went on a helicopter ride around, and it was a sunset helicopter ride, and it was really, really special. And while I was up there, I remember thinking, I am so blessed that this is what I do for a job, that I have the opportunity and the privilege to be able to see these things. And I know it's taken a lot of hard work to get to it, and a lot of sacrifice and a lot of risk, but I am living a life that is so full and right, and the path that I wanted to go, like the direction I wanted for my life. And having those little moments where you just go, I'm so thankful to all the people that encouraged me along the way and kind of got me out here and made it happen. And just those little parts of fate where you think, if that never happened, that never would have happened. I'm a big believer in the butterfly effect and chaos theory, and I think everything happens for a reason, and wherever you are in a moment is where you're meant to be. And I genuinely feel that every single trip I go on, which is really cool.
Where was that? I've got to ask where the other one was. That was like, because I was in Uluru last year, and I'm like, you're right, it's so spiritual, like you can feel it. And then you're like, and then there was this other one, I'm like, what's that?
So the other one is more of a, it's not like a pretty landmark. I actually had a car crash. I was going to Water, and I had a car crash which was really unfortunate. It was really, frightening. It was handled incredibly. I was really well supported by all the management team, and I was silly enough that the nurse and we were asked, do you want to go out to the remote community, or do you want to stay here and just take a day? You don't need to go out. We'll change your flights around. We'll change things around, get you accommodation. And I sort of looked at the nurse and I thought, if you're happy to go, I'm happy to go, because I just look at it as the community needs the service.
And you felt okay?
I felt totally fine. I mean, I was a bit like, my neck's a little sore. It was fine. I ended up walking on the treadmill that night type of thing. I was fine. It was more just the shake-up of having a car accident. But she said, no, let's get out there. And I think because when you're working on the ground, you do unfortunately see how underserviced these places are. And it's not because people aren't trying, it's because we do have lack of funding and resources to get out there. But when I sort of look at it and I go, this is 3 weeks that they're relying on, no one's been here. Well, I was actually the last person that was there, and that was 4 months before. And I know that each child needs, on average, 3 to 4 teeth extracted or filled, and there's X amount of kids in the community. These people need this service. So taking 1 day away is just a non-negotiable for me. I'm like, if I can work, if I'm okay, I'm getting out there. And so we went. And I woke up the next morning and I couldn't get out of bed. So I was very stiff. Anyway, long story short, got the health clinic doctors to check me over. They said, we need to actually send you back to Darwin for a CT scan. My management team wanted a physio to clear me to be able to go back, because dentistry is so heavy on your neck. So I did that. And anyway, I ended up having to stay in Darwin that weekend. And I'm a big believer of doing things on your own, and I, for the last 2 years, have been forcing myself. I mean, I live a very independent life as it is, but I go to concerts by myself, and I love doing it. It's just kind of like my thing now. And I went to a concert by myself, and I met someone, and that was about 3 months ago, and I'm now moving to Darwin to be with him.
Oh, wow.
So that was another trip that, I mean, even though I had a car accident and I thought everything was just going crazy in a way, him and I had talked, and I said, I kind of had that realisation that if I never had a car accident, I wouldn't have met you. So that trip was special for its own reasons.
And if you don't put yourself out there.
If he heard me say this, if he's listening...
What's his name?
Will be.
Sorry, Max, darling.
Should be moving to Darwin, so I was like, it kind of has to. Even if it's on 1.5 times speed.
Yeah. If he heard me say that the Central Australia trip was my favourite, I think he'd be upset. So I have to just say that, that was actually my favourite trip.
And so is he from Darwin?
No, he's from Redland Bay, so Brizzy. But he actually lived out in a remote Aboriginal community for 2 years, and now he's living in Darwin, and he's a pilot actually. He flies the little planes that we go out in. So
that's a beautiful story.
What do you think? Are you going to miss the remote work?
Or will you still do?
No, I'll still do it.
Yeah, from Darwin.
I'll still do it, just not in a locum capacity. So I'll still be going. I don't know how frequently it is, but I dare say it's probably every 3 or 4 weeks. But rather than doing 3-week stints or 4-week stints or 5-week stints, it'll be 3 week. It'll be one week. So Monday to Friday, much more manageable. But there's a lot of blessings that will come with taking that shift. But I know that my career calling is to continue locuming. This is just what I have to do.
There's
for
a moment
love.
right now for love.
But how amazing that you can base yourself somewhere like Darwin and still do the work that you're passionate about and the opportunities.
Absolutely.
And also that you can locum and still find love. Because I think
that is a big concern for people.
That is how you find love.
I'm young and I don't want to be out. Yeah. How do you find love? And you're like, well, I'm going to concerts on my own.
I had actually... I was so not interested in dating. I sort of had been on first dates a bunch last year, and I'd gotten to a point where I thought, no, you know what, I really just want to focus on myself, and I'm going to just move to the Torres Strait, and I was going to do a longer locum stint in the Torres Strait and take my dog up there and be based with my dog, because that's a tricky thing with locuming, having those responsibilities. And so I wanted to go up to the Torres Strait and just live there. And I remember when I met Max, I just said, no. be gone. I'm moving. Like, this can't happen. This isn't
Now's not the
going to
time.
work.
I got plans.
I've got big plans, and it's not, it's not like I'm based in Brisbane and well, so what? It's a 4-hour flight. You can make that work. It's the Torres Strait, so it's a flight from Brisbane to Cairns, Cairns to Horn, and then a ferry to Thursday Island or whichever other island you're based on. So I was like, logistically, we can't.
This isn't going to be a thing.
This will be distant.
Yeah, stand down, Max.
Yeah, but it didn't take
But it
long.
is.
I actually ended up extending my stay on the flight back from Wadair to Brisbane. For Wadair to Darwin, Darwin to Brisbane, I ended up extending it to spend more time with him and just sort of go, is this something here? And
it is.
And it is.
So your dog, is it Sailor, your dog?
Sailor, yeah.
So Sailor goes with you on these locums.
Because where is your base?
Yeah.
Where
I'm based in the Sunshine Coast.
Okay.
My mum is down here in Brisbane, but I have... So you can take your dog on certain placements, by all means. Not so much remote Northern Territory communities because it's just logistically it's impossible. I wouldn't want to... I mean, Sailor's a 32-kilogram Doberman.
Oh, my God.
So she's not going on those tiny planes.
On the four-seater, there's no room.
I would love that.
Sailor was like this tiny French bulldog or something.
She's actually crossed with Great Dane as well. So she's everything. And
She's probably bigger than you.
She's pretty big. I love it.
So do you drive around to get to your placements with her?
No, so my mum takes her, or I have people come and house sit. So I've had friends, come and mind my house and mind my dog. But lately it's been mum.
Yeah.
Cheers, mum. But with this move to Darwin, she's going to come with me, and then when I go out remote, she's now Max's responsibility for those weeks.
Are you going to drive up?
No, I was going to, but logistically it made more sense to just fly because I'm actually doing another stint up in the Torres Strait. I'm going to a little island called Bardu, and that's going to be 3 weeks, and then I'll actually go directly from Cairns or Bardu. There's one other stop in between there, and then wherever that is to Horn Island to Cairns, and then I'll go Cairns to Darwin. And Mum will put Sailor on the plane and I'll meet her on the other end up in Darwin. She's been up there before. I've actually taken Sailor all around the country.
It's amazing.
This dog has a lot of fires.
She's got a great life.
With locum, I think you don't realise you can take your dog, and then when you hear about the logistics too, to
anything's
get to some of these places, but you can do that and still have your dog. And fun love. Tick, tick, tick.
And it sounds like you build beautiful friendships and things.
Yeah,
you mentioned,
definitely.
Nurses that you travel with, and I think a few guests that we've had on, and certainly our candidates talk to us about
like the friendships and
like
the
almost
community.
Feeling more part of a community.
Absolutely.
Doing this.
I think so. I've made some really good friendships doing remote work, even back, going all the way back to when I was 18 or 20. I think it was 2021 when I first started doing remote work. And I mean, any industries, you're gonna connect with people and you're gonna make friends. But I think when you are doing something so unique, you have this bond. The other person gets it. They know the challenges that do come with it, because I'm not going to be naive to the fact there is challenges with remote work. But they get it. They understand, you get home and you need a few days to reset and find yourself again. So there's almost this like camaraderie with it that I really appreciate. And I think I mean, one of my friends is probably one of the dearest friends, and I only met her doing this work. And yeah, it is very special. Another friend I met is a woman in her, I want to say, late 60s. And she's actually a prison nurse, and I was paired up in a house with her when we were based in Alice Springs for the weekends, and we still message and give each other life updates, and I miss going home to her every day and just chatting and hearing all the goss. So you connect with people that you probably wouldn't otherwise even cross paths with necessarily. You wouldn't even really, I wouldn't think that I would connect so well with a woman that's my mum's age. But she's just someone that I have so much respect for, and we plan to meet up in Adelaide. She's from Adelaide, and she's doing this in her 60s, and she just got a dog. She rescued a dog from Alice Springs Pound, and she flies. I don't know if she's doing the drive. She was playing around with the idea of doing the drive or doing the flight. So I think anything is really possible with this sort of work. You just have to take the challenges with it and take the risk.
Yeah. What do you think's important? Because whilst it clearly really agrees with you and your whole philosophy on life, it won't suit everyone.
Absolutely not.
What do you think are the really important things people need to be mindful of, or really have to consider whether it's for them? Like, you know, that flexibility piece, obviously, I assume a bit of resilience or something.
Yeah.
But what is it?
What are the challenges?
Yeah. What is it that people really need to consider?
I mean, that's hard to say because I find it all so fun and amazing.
Yeah.
I was just going to say that because you're all, because when you say but there are challenges, like what are they? Because you're so,
They're not challenges.
I love it. Everything's great.
I say yes to pretty much anything. So I think the challenges would be, for my own stuff, if I'm really to dig deep and reflect on it, it would be that I'd never been on a plane before I moved to Alice Springs when I was 21. So I'd only ever, I lie. I had been skydiving, so I jumped out of planes.
I love being like, I went skydiving, no.
But I guess you
feel
hadn't travelled then.
I'd never landed in a plane, you know. I'd never
just landed on your feet. Or your backside.
So I'd been skydiving twice, but then, this was, I remember my first stint. I went out to Alice and I was so excited that I was landing in a plane. I was like, this is amazing.
Was it what you expected?
Not at all.
Yeah.
Not at all.
How so?
From I think my lack of understanding being that young as well, and growing up in just a coastal suburb in New South Wales, I was so far removed from what life is like in remote locations, but in Indigenous cultures. I think we have this. There's so much distance between what we see on the TV, on the media, and the news, than when you're actually on the ground and you're seeing it firsthand. You end up. I felt very. I had this sort of appreciation for the fact that I was experiencing and witnessing something that in some ways is really hard to see and to accept that this is going on in our own country. And
what's going on?
Yeah.
What
just in terms of like the disparities in healthcare and education and living like lifestyle, the social issues. I think there can almost be this label put on remote areas that there's so much trouble and there's so many issues, and there is, but there's a lot of people out there doing good and helping, I guess, how would I say it, almost like the intentions are in the right place to actually see change and to facilitate change. But I guess when you are that young and you go out and you have had this one concept of what working in Indigenous healthcare is going to be, and then you see what it really is about and all the beauty in it as well. It's something that I really am thankful for, because I think I wouldn't understand it otherwise, obviously. But I can share that with other people and sort of change that lens of the reasons why we have problems in remote communities and with our First Nations people is because of generational trauma, and it's because of poverty, and it's because of what happened, and it's because of colonisation. And I think if you put yourself on the ground and be amongst that, you start having empathy rather than judgment. And I'm thankful that I feel like I've helped shift that lens for other people that haven't put themselves in those positions, if that makes sense.
And coming from that real place of curiosity, I imagine, when you go there, of just listening.
And just being present with it as well. But I've learnt so much in terms of how family can be, and how it's, you've got like large families, but there's toddlers and 9-year-olds that are looking after the babies, and it's so collective. They're really collective communities rather than this sort of singular, mum, dad, 2 kids type of thing, and they're responsible for it, and you might have the grandparents. But when you really understand, or when you get to know that even things like explaining dental treatment or consent to do a treatment for a child, there's multiple people involved in that process that look out for that child and care for that child. And I feel like that isn't always shown in the media, but it is when you're working amongst it, and you can see what family really can be. I think those are little things that I'm really thankful for.
I was just, no, you go.
No.
I was just going to say, like, you're so passionate about the work that you do, and you've talked a bit about, like, you had the privilege of learning these things people don't know. Do you ever think about mentoring students, or, like, are you at that point yet?
Because
I would love to do.
Do they know it exists? Did you know it existed, or how do we amplify this message?
I think, I mean, I was really fortunate when I went to university, having already experienced remote work and working with Aboriginal people, and just, you know, understanding a little bit about the culture that I wouldn't have otherwise. When I went to university, a lot of my peers would say I was a big advocate for Indigenous rights, Indigenous healthcare, working with our First Nations people, not for them or at them. And I think that's really important, as well as going into situations or clinics, or no matter which industry you're in, really, and asking people, like, how can I help, or what do you need and what do you want, not I'm here to do this. So I feel that in my passion and advocacy for Indigenous healthcare, and the conversations I have with people, and that even, I mean, I probably annoyed the students so much because I would, you know, say something in a lecture where I would say, oh, this is part of what I've experienced and what I've witnessed, and just made people look at things from a different angle. I ended up actually being a student mentor at uni. So when I was in my second year, I mentored the first years, and then I was the academic representative as well. So I had a role and a position in just my cohort where I could have these sorts of conversations with people. And luckily, I've been asked to speak for universities, doing, I guess, just sharing my experience.
Sharing your experience. Because do they ever remotely, like, talk at uni about this remote work?
I was lucky at Charles Sturt University that it is, there is a strong focus on public health and working rurally and somewhat remotely. I think there's maybe more of a focus on rural work, sort of regional New South Wales, and even regional Victoria. But remote is kind of that, if you're game, you can go do that.
Yeah, because there's a big difference between rural farming communities and things, and what you're talking about today.
Because I never talked about that when I went through occupational therapy. I never heard about it. So it feels like it's this constant thing where people are like, we don't know this exists.
I don't think it's highlighted as the opportunity that it really is. I think
that's across a lot of industries, right? Yeah. Like, I imagine teaching and various...
Definitely.
And also there's probably that perception that you need to have worked for a lot longer to be able to go out to these communities.
I'd been out of uni a year and a half before I moved to East Arnhem Land and worked as a regional oral health coordinator. So I put, a big girl hat on. And
did you feel supported? Like, was it daunting?
It was hard because I think at that stage of my career I probably should have been focusing more on my clinical skills and being mentored. So I think I bit off more than I could chew in a way, but I'm so open to experiences that scare the life out of me.
Because you probably got thrown into a much larger scope, I'd imagine.
Yeah, definitely. Well, there was the communities that I was sort of responsible for facilitating dental services to was there was about 9,000 people, and then you share that role with the Northern Territory government, and even just working sort of across organisations is really tricky as well. So, and there'd been no one in the position for years, so I didn't really know where to even start, and I thought, what can I do here and what can I do well? Like, where are my skills that I've developed over the years by doing this work? And so much of that was oral health education. So a big part of my role there, I mean, I was dictating it in a way, was going out to the schools and implementing toothbrushing programs and going to the aged care facilities. And there's a funny story with that one. My partner at the time, she was an aged care disability support worker, and she helped me like round up, the little old ladies, and I gave this big session. I had cutouts because English is not going to be the first language by any means. It's usually the fourth language, and you learn little bits of the dialect, so you know how to say teeth or how to say water or how to say sugar, but. I was doing this in a way that I thought was culturally appropriate, and I had pictures of teeth, and I did this whole session. It went for about 20 minutes, and then I said, okay, I'm going to do a screening so that then I can facilitate this as an urgent care treatment. This needs to be addressed ASAP. And a lot of the women, one woman didn't have any teeth. But the opportunity still is. I sort of said to my partner, I was like, I feel like you should have screened this for me. But the thing is that the oral health therapist in me is that oral health therapy and dentistry isn't just teeth; it's soft tissue. So you're looking for looking for oral candida, which is like an oral thrush, which can be associated with certain medications. And when you have people that are medically so compromised, a lot to do with simply being Indigenous, which is really, really unfortunate and really, it's a terrible thing. They have, a lot of medical conditions and chronic diseases, and there are other conditions that we'll see in the mouth that aren't related to teeth specifically. Yeah. So I still took the opportunity as one that
I can do things
we
here.
Can still do this.
We've got to get a couple more pictures.
And isn't that just life though? Like,
100%.
you can plan something and you have your vision of which way it's going to go, and life is going to go, no, let's shake it up a little bit for you. And I find the beauty in that, because now it's something that I look back on and I think it's funny, and now I've told you guys. So.
I love it.
And I think everyone in Australia deserves the right to access healthcare.
Absolutely, yeah.
And I think that's, you're doing such a wonderful job out there, and I think the promotion piece of health is so important. Yeah. And the funding, if it can go there, then you have less thereafter.
Yeah, I think we're so focused at the moment on and we have to be is fixing the issues, like fixing the abscesses and the dental,
which is the reactive
decay.
stuff, right?
It's really reactive, and I don't know if it's just the way my brain works, but I like taking a step back and going bigger picture. Why are we here? And maybe that's just been ingrained in me from being a therapist, because that's the way that we're designed to look at the body. It could be just the way I am. Who knows?
Why are we doing this? Why are we doing this?
Yeah. So I feel like if you look at the bigger picture, though, you can direct that funding or that change into a way that you can then actually achieve your goal on a broader scale, and it will take more time, and it will take more understanding and more, planning and whatnot. But when I was at uni, my research was in, this is going to be an awful thing to rattle off, but maternal hypovitaminosis D, so essentially vitamin D deficiency in pregnancy of the pregnant mother. Yeah. So specifically the second and third trimester is really important for the development of the baby's enamel or their teeth. Right. So at a cellular level. We were looking at, I did the project by myself, and I was looking at all the literature around vitamin D deficiency and how that interplays into the child's oral health in the future, because if you have poor enamel quality, you're going to have high risk of dental decay. So what I was looking at was, how is vitamin D, how do we end up being vitamin D deficient? And, there's diet, and we all know sun. So sunlight is a huge thing. And it's like, okay, well, you're out in remote Northern Territory, there's a lot of sun. But the thing is that vitamin D is synthesized in the skin. So our First Nations people, especially out in remote communities, very, very dark. And so they're not absorbing, or they're not synthesizing the vitamin D the way that you would want to, so they're often vitamin D deficient. So when I was working up in that coordinator role, I worked with a dear friend who was the director of medical services, and she was really fascinated by this research, and she ended up doing vitamin D screenings for the pregnant mothers, and in that way they can then supplement those women that were vitamin D deficient, and in some, long-standing effect, that enamel is going to be stronger. So we should stop seeing, in some small capacity, obviously there's so many ways that you can end up with dental decay, but you need multiple factors. You don't just have sugar on its own, and you don't have, lack of fluoride on its own. You need poor enamel quality. So if we have strong enamel, then we have that
You're off the right starting point.
It's a better, and that is literally how far back in terms of prevention can you really go. We can supplement with fluoride in the water, which we don't do in remote communities because the logistics of it is too difficult. It's maintaining water fluoridation plants is very, it's a huge job. And I mean, some communities have 300 people in them. So if you look at how can we tackle oral health care from a true preventative point, or let's go back as far as we possibly can and just check the vitamin D of the pregnant mother. So that was something that that research at uni, then I used it out in the real world, not in just, learn how to do a filling or learn how to take a tooth out or learn how to
and even just not
gum
studying
disease.
it there in the classroom, to actually see it firsthand like that. That must be wonderful.
And you see really poor enamel quality. So a lot more, there's a condition called molar incisor hypermineralization, and I've never seen it to the scale that I do when I'm working out remote with our First Nations kids and adults, I should say.
Good research.
Oh, look, I feel like we could talk for hours.
We always say that.
No, but it's so true. It's really hard. It's really hard.
So
CMR are going to be making a donation to a charity of your choice.
Okay. Thank you for doing that.
What charity?
So I don't actually know how to say it.
We'll work that out later.
This can be awkward.
It's DAIWS, and it's Darwin Aboriginal and Torres Strait Islander Women's Shelter. So it's for domestic violence, people that are experiencing domestic violence in remote communities. So that would be where I would want you guys to donate.
Yeah.
Thank you, Karli.
You're
just such a, you're so
just
beautiful to listen to. Just hearing you talk.
So nice to hear someone who's really doing the work that they're literally meant to do.
I still don't think you've found a single challenge that you...
I know, there's still no challenges there. But we talk about the right people in healthcare.
The challenge would be, the biggest challenge for me, and it's such a personal one, is being away from my dog. Yeah. But even in that, there's a way around that because it just depends on where you go. I mean, there was the opportunity to go to the Torres Strait, and I would be living on Horn Island with my dog, and I would just catch the ferry over every day, which the kids do for school anyway. So even that's not even a challenge. It's something that there's a way around it.
There's always a solution.
I think every challenge for you is an opportunity, and I love that. And just thank you for all these communities, even to think to take your research and then the impact that's having. You're so passionate about what you do, and it's amazing. It's inspiring to hear. I'm sure there'll be someone who'll listen to this and go, oh gosh, I could do that.
I could do that.
Yeah.
And I want to go and experience it.
Anyone can, if there's something that scares you, if there's something that scares me, my immediate reaction is, I've got to do it. Even skydiving, it's one of those things.
You skydive before you go on a plane.
I just think that life is so full of beautiful opportunities, and there's so many. It's that typical thing of if one door closes, another will open. I just think there's so many doors, but if you don't start going through them, even the ones that you don't know what's on the other side, stop planning your life and stop trying to put all the puzzle pieces together. Just take a risk where you don't know the unknown, because I think there's so much beauty in trusting the unknown, and it's allowed me to live a really amazing life. So thank you guys for sending me out to communities.
Yeah, no. Well, hopefully we can get you back out there.
Yeah, you will.
Enjoy Darwin. But,
I'll enjoy Darwin.
But
he'll have to come back this way.
There might need to be a little bit
it
of
sounds
a
like there's still
back.
a lot of areas that you haven't explored. So
there's
all that you need to go back to.
So many. Yeah. I'm excited for for the next chapter, and then I'll be a locum again.
Max can fly you around.
Yeah, well, he will be my pilot at some point. He actually flew a friend, a dental nurse friend, the other day, and he was late to the to the flight.
You're a good match.
Is that your
flight?
Exactly.
I mean, you two together.
Maybe
we should be recruiting pilots so that we just think about it. Like they're taking you all around, like remote.
Yeah. He ended up flying in and he said, "Oh, hi, sorry I'm late. My name's Max. I'll be a pilot flying into whichever community it was." And Rachel said, "Max?"
Mm-hmm.
And apparently he said, "Oh, that's Rachel," because he'd met her. And he said, "Oh, I'm in love with your friend."
Oh, bless.
So that was the first time the L word got used, and I was like, "That's
and
a
you
bit
weren't there to
special."
hear it.
Wasn't there to hear it. But yeah, it is pretty special.
It's been a great journey. It's been great to have you here today. Thank
you.
Thanks, guys.
We care for the land and sea.
We acknowledge the traditional custodians of the land of which we meet, who for centuries have shared ancient methods of healing and cared for their communities. We pay our respects to elders past and present.